It's a Northwest Lifestyle Weekend on Como News. Here's Tom Hutler and Shannon O'Kelly with more IRG Health Talk.
Our next guest is Sumedha Kukreja, occupational therapist and owner of Virtual Kare. That's Care with a K. Their clinicians are developing and presenting customized online group classes and disease-specific prevention and wellness programs that can be done in a patient's home. And Shannon, this is a great idea given the limitations that we have about being able to get out in public.
Oh, it's absolutely a fantastic idea, and we're excited to partner with Virtual Kare, providing that class-type setting for our patients that need additional care.
All right, let's hear what Sumedha Kukreja has to say with Shannon O'Kelly right here on Como.
Welcome to Health Talk. How are you?
Oh, thank you, Shannon. It's a pleasure to be here.
It's a pleasure to have you. I'm excited to talk. We're going to get into the nitty-gritty, but tell us about your background, your training, your education. Kind of give us an update on what you're doing and how you got to the place where you're running this organization now called Virtual Kare. And like I said, we'll get into it, but tell us, our listeners, about your background.
Thank you, Shannon, for the question. So I'm an occupational therapist by training, and my partner, Jay Berger, is a physical therapist by training. So we both have been working as clinicians for more than 25 years each. I've worked around the world and had various experience with different healthcare systems. And as we see, the world is changing.
Yes, it is. Yes.
And so is our healthcare. But I think as a healthcare professionals, we felt our healthcare is not catching up to the needs of the people. So that is how it all started, because as clinicians, we felt that, our patients need us even when they don't see us. And they still need to continue with the gains they have made, especially with therapists, because we are therapists. So they worked with their therapist, and we feel they need to keep working. They don't need to keep coming back to us for the same issues if they had just continued working on what we told them. So that is how it started. So we said, okay, let's do something. We have technology at our hands now, and let's make it work for people, especially with healthcare putting more and more burden on people to take care of the cost of their care. So Virtual Kare was born as from a clinician's perspective, what we felt people needed, or what people told us they needed after they ended with their therapy or when the insurance ended their benefits.
This is great. I mean, I can tell you personally, firsthand speaking here, so many people run out of benefits, and they run out of benefits early, maybe too early to complete that plan of care or provide them what they actually need to be injury-free or safe going forward, right? And Virtual Kare allows a class-type setting. When you're talking virtual, it's done on the computer. It's interactive video, classroom-type setting taught by physical and occupational therapists. Tell us about kind of the platform that you're built on.
So we are using different video platforms at this time, but our focus is more on the clinicians who work. So we have picked up the best of the best. We try to integrate perspective from different clinicians, because I feel as collaboration we can bring more, since it's a virtual environment, not dependent on a skill set of a single clinician. So we try to bring that in, and my partner Jay and I and a couple of other clinicians, we get together and build up a program that we feel the patients would need and they can benefit from. So as they keep struggling, especially if they keep growing and working with their clinicians off-site.
So there is the opportunity. I mean, the transition opportunity here is these people, patients, can work with a therapist, occupational therapist, PT, one-on-one, and then transition to that's how we're going to collaborate together, IRG and Virtual Kare is. IRG is going to provide the one-on-one care, and then if the patient is appropriate to transition to Virtual Kare class type setting, you guys are there, and it's a win-win situation for continuity of care and continuous care for the patient. Tell us about your programs that you offer, some of the classes that you offer.
So thank you, Shannon, for that. Yes, they can come to us, and if they feel one-on-one, then we can send them back to you, because that is what helps a client, so they have hand-holding all the way. So some of the classes are Parkinson's program, better breathing classes, which never go away. So people need to keep continuing working on them throughout their healthcare journey.
All right, we're going to continue our conversation with Sumedha Kukreja from Virtual Kare. That's Care with a K. And we'll be back with more right after this on Como.
It's a Northwest lifestyle weekend on Como News. This is IRG's Health Talk. Back to Tom Hutler and Shannon O'Kelly.
We continue our conversation with Sumedha Kukreja and Shannon O'Kelly.
Thanks again for joining us on Health Talk. Thank you for sharing your information and your business. Virtual Care, taking classes to those folks out there that need it virtually. You know, we're excited at IRG to be collaborating and partnering with Virtual Care because we think it's going to provide a great treatment option for patients and continuous treatment. And your providers, your classroom instructors, are PTs and OTs. You mentioned 2 classes. You mentioned Parkinson's classes and a breathing class or a lung program. Do you have any other classes coming up in the future? Any other ideas of classes?
Yes, we have, besides these 2 classes, we are working on a program for chronic pain patients, and we are also working on urinary incontinence, because those are issues that people struggle all their lives. Some of them, especially urinary incontinence, is a great start for that because people want to do it in the privacy of their homes. And as virtual care programs are provided, they are virtual, so people can do them in their own environment, in their own homes. So we just want to bring those programs which people don't even realize sometimes that they have an issue which can be easily solved. So we start with them, educate them, and if they need one-on-one, they come back to IRG, but they can do those classes virtually in a group setting to start with. Because healthcare is costly, and we want to get people what they really need and when they need it.
So if I miss a class, let's say I'm interested in taking the classes and I can attend the first class and I'm online doing the first class, but I can't see the second class. Are these classes recorded where the patient can then log in, or are they live virtual classes? Do you know what I'm saying? I mean, are they recorded where I can get in and play and look at a recorded class, or do I have to go to a live class? Any thoughts on that?
We do both. The advantage of a live class is you have an access to a clinician and an opportunity to ask questions.
Oh, you can ask questions during the class. Oh, that's great.
Yeah. So, which is not, it's not like a YouTube channel video where you watch and you're struggling it on their own.
Right.
Right?
Exactly,
right?
yeah.
So, you have that opportunity, but if you cannot attend a class in a live session, they can see the recording later on of the session. And again, we have that interaction with the clinician at all times because we need to provide these patients with support. Healthcare is complicated. Online is very noisy. People nowadays just go online and look for solutions which may or may not work for them.
Yes. I love your classes and I love the ideas of your classes. I mean, you right now, your target market, kind of the emphasis right now, I would imagine, are maybe patients that are a little bit anxious about maybe going out into public or maybe being in social settings just because of this virus situation. Are you going after anything in particular from a market share right now? What's your emphasis on your marketing?
So again, our focus is more on prevention and wellness. We are targeting assisted living facilities, adult family homes. So we want to have those people access to those classes in their confined places, whether it's home, assisted livings, or adult family homes, so they stay healthy and stay out of those hospitals.
Yes, exactly. Hey, thank you for the information. IRG, we are excited to be partnering with Virtual Care. And let me tell you, I love your passion. I can tell this is going to be very successful, not only for your organization, but also for the patients that experience your Virtual Care classes. Thank you for joining us on Health Talk.
Thank you, Shannon.
All right, you've been hearing from Sumedha Kukreja at Virtual Care. And tell us again, Shannon, quickly how you guys are partnering with them.
Well, we are providing the one-on-one care for the patient. And if the patient then needs or would benefit from continued care via a class-type setting, we can transition that patient to the classes that Virtual Care offers. And again, these classes are taught by therapists, and the patient can experience wonderful care in their home.
All right, we're back with our